I am Dr. S. Mishra. I am a dental surgeon and I welcome you all to my channel. Now Ask the Doctor. Today, our topic of discussion is teething. We will discuss everything about the teething process in babies, their discomforts, the symptoms, and how we will relieve their discomforts. We will also discuss about the causes of delayed teething. So let us start. So what is teething? Simply, teething means tooth eruption. So it is a process by which a tooth moves from the pre-eruptive position in the alveolar bone through the oral mucosa into the oral cavity. So teething simply means a process by which these are tooth buds, by which these tooth buds erupt and they become visible within the oral cavity. Now, the timing of tooth eruption, it varies widely. Most children get their deciduous tooth around the 6 months of age, while I also have patients where their first tooth erupted after 1 year of age. In most cases, this the lower central incisors are the first tooth to erupt, but there are always exceptions. These are the lower central incisors, and in most cases these are the first teeth which erupt into the oral cavity. So in most cases the lower central incisor usually erupt first and the molar erupt last. The average child acquires one tooth per month between 6 and 30 months of age. The symptoms usually occur few days or even weeks before the tooth comes. So now I will discuss about the symptoms. So what are the symptoms of teething? Number 1, biting. Now the child has more tendency to bite. Number 2, drooling of the saliva. Number 3, red swollen gums, but in some cases only. Number 4, gum rubbing. So there is an irritation in their gum and the baby will put their fingers inside their mouth more frequently because of this irritation. Number 5, irritability. The baby will become cranky, they will cry now and then. Number 6, decreased appetite. But this is temporary. Number 7, temperature. But there is mild elevation in the temperature, say around 100 degree Fahrenheit, but not high fever. And number 8, diarrhea. Now coming to this point. Now, teething does not cause diarrhea directly. The association between teeth eruption and diarrhea in infant is actually a hygiene issue. Around the age of 6 months, a child starts bringing the first set of teeth. They are crawling and they have a tendency to pick things from the floor and put them straight into their mouth. So, introduction of bacteria through their mouth into the intestinal system gives rise to this diarrhea and not the teething process directly. Now comes treatment. So what is the aim of the treatment? The aim of the treatment is mainly to relieve the irritation in the gums of the babies. So what you can do? Number 1, you can give them textured or cold teething rings. Now why cold? Because the cold temperature of the object causes vasoconstrictions, and this localized vasoconstriction decreases the inflammation, and biting the object or the teether gives further relief by applying pressure to the gums. Now, liquid filled teethers should be cooled in refrigerator, not in the freezer, and they should not be sterilized in boiling water. You simply wash it with utensil cleansing liquid and warm water. Now, why not in boiling water? Because the extremes of temperature can disrupt the plastic material and lead to leakage of the fluid, which is very hazardous. The use of disononyl phthalate, I think I'm pronouncing it in a right way. So, the use of disononyl phthalate in plastic teethers, which is a chemical used as a softening agent during manufacturing process, is also a source of concern. Animal studies show a variety of toxicities and carcinogenesis. No human studies available till now. So always check the quality of the tether, its composition. Buy good quality tether. And also check for one thing, sometimes it is mentioned that is BPA free. Now what is this BPA? I will tell you about this BPA. So BPA is bisphenol A. So what is this? This is an organic compound which is used in the manufacture of plastics. Studies show ill effect on brain and prostate gland in infants children. So this should be avoided. Try to avoid things containing BPA. Now, one very important thing is that if your baby is putting anything inside their mouth, supervision is important. The supervision is important to prevent choking hazards. The next thing what you can do, you can also dab moist cotton pads frequently in their gums, and I think this is the most safest way and easy way. Now, what are the causes of delayed teething? Number one, impacted teeth. That is, when there is some sort of hindrance to the tooth erupting by adjacent tooth or by overlying tooth or the bone. Number two, Down syndrome. It is common for children who have Down syndrome to be of 4 to 5 years of age before they have complete set of deciduous teeth. Number three, cleidocranial dysplasia. So, cleidocranial dysplasia, it is an autosomal dominant disorder affecting the clavicle and causing cranial and facial abnormalities, including delayed eruption of deciduous teeth. Number 4, congenital hypothyroidism. Failure of the thyroid gland to develop properly results in a low concentration of the thyroxine hormone, which leads to abnormal growth and development and delayed teething. Number 5, Gaucher's disease. It is a lysosomal storage disorder. Number 6, osteopetrosis. So, it is a defect in bone delaying eruption. Number 7, rickets. Nutritional deficiency of vitamin D that leads to the failure of proper mineralization of the bone and affects tooth eruption. So, babies should be given vitamin D drops regularly after birth as prescribed by the pediatricians. Now, babies who were born premature and who had a little less birth weight, they can get their teeth a little lately. When you will say there is a delay in teething, so after how much time or after what age? If the child does not have any teeth by the age of 18 months, 18 months, then he or she should be taken to a dentist for evaluation. That's all for today. If you find my video helpful and informative, and if you think I can contribute something positive in your life and I can make you a little more aware regarding health related issues, then please share it with your near one, hit the like button, and please subscribe to my channel for more health related videos. Thank you. Stay healthy and stay happy.